All right, guys, chapter 11 really goes through all of the muscles in the body. So this is 160 slides worth. I'm not going to go over all of the slides because you're going to learn a lot of these muscles as you study for lab, but do use this PowerPoint as another study guide as you're learning the muscles. As far as other content, so besides being able to name the muscles, I'm going to go over some of the content that you need to know from this chapter. There's kind of the first part of this chapter goes through the mechanics of muscle function. Then it goes through labeling all the muscles in the body. And then at the end, it talks about some surface anatomy, ways that we can kind of see what's going on below the surface of the body by seeing what's on the surface. So your skeletal muscles are attached to the bony skeleton to produce movements, and the physical parameters define how a muscle will act on the bony skeleton. The vesicular arrangement within the muscle, the principles of lever mechanics, and the position of a muscle as it crosses a joint. So your skeletal muscles consist of fascicles, which are arranged in different patterns, and the fascicle arrangement tells us a lot about the action of a muscle. If a muscle is a circular muscle, the fascicles are arranged in concentric rings that surround external body openings like a sphincter, or the orbicularis oris or the orbicularis oculi muscle, which are circular muscles around the eyes and the mouth. Convergent muscles is when the origin of the muscle is very broad. The fascicles will converge toward the tendon of insertion. An example of this is the pectoralis major muscle. I think that might be a test question. So you do have to know some examples of these. Parallel muscles are when the fascicles run parallel to the long axis of the muscle. It's strap-like with the sternocleidomastoid or fusiform like the biceps brachii. Pennate muscles are the unipennate is when the fascicle inserts into one side of the tendon. Bipennate is when the fascicles insert into a tendon from both sides, and multipennate is when the fascicles insert into one large tendon from all sides. So these are examples of the different patterns of fascicle arrangement in muscles throughout the body. And again, I think you do need to know, I think this one might be a test question, an example of a convergent muscle. And then you can see other examples of bipennate, multipennate, parallel muscles. So there's different examples of how these fascicles are arranged. A muscle cannot reverse the movement it produces. Another muscle must undo the action. So muscles with opposite actions lie on opposite sides of a joint. The prime mover is called the agonist, and this has the major responsibility for a certain movement, and the antagonist opposes or reverses a movement. A synergist will help the prime mover by adding extra force, by reducing undesirable movements, and a fixator is a specific type of synergist muscle that will hold a bone firmly in place. So these are just examples. A muscle that crosses on the anterior side of a joint will always produce flexion. A muscle that crosses on the posterior side of a joint produces extension or straightening. A muscle that crosses on the lateral side of a joint produces abduction, so taking a muscle or body part away from the midline of the body. And a muscle that crosses on the medial side of a joint produces adduction or bringing it back. You will need to know a couple actions of these muscles, but the ones that I picked for you on your exam, hopefully, if you think about how the muscle contracts and what parts of the body it attaches to, that will tell you what action it has. So for example, your biceps muscle works to flex your forearm, and the triceps muscle on the back of the arm helps in extension. The axial muscles are all that lie on the anterior and posterior side of the body axis. These are muscles of your thorax, your abdomen, your pelvis. They function to move the trunk, maintain posture, and many muscles of the neck are also in the axial muscles. They develop from myotomes and some somatomeres, which you don't need to know. The ventral regions of the myotomes, muscles of the trunk and neck, are your respiratory muscles on the front, the anterior abdominal muscles, and muscles of the pelvic floor. So this just shows how muscles will develop from the different myotomes of the embryo and where they'll develop in the body, but I don't ask you guys any questions about muscle development. The limb muscles arise from lateral parts of myotomes. Extensors are the muscle mass on the dorsal or posterior side of the limb bones, and flexors are the muscle mass on the ventral or the front side of the limb bones. In the upper limb, Your extensors are on the posterior side, and the flexors are on the anterior side, always in anatomical position. And in the lower limb, it kind of rotates. So your extensors are on the anterior side, and the flexor muscles are on the posterior side. So this is a look at where your extensors and flexors are in the upper and lower limbs and examples of each. Extensors in the lower limb will like kick out the leg like you're kicking a soccer ball, and flexor muscles will kind of kick back like you're kicking your butt. Extensors in the upper limb will straighten the arm, and flexors in the upper arm will flex the arm like a bicep curl. The dense fibrous connective tissue will divide the limb muscles into compartments. Muscles in the same compartment have similar actions, and they act as synergists to help each other to do the same muscle action. Muscles in opposing compartments will act as an agonist and antagonist pair, so they'll have opposite actions, and each compartment is innervated by a single nerve. The upper limb has anterior and posterior compartments. The anterior arm compartments will flex the shoulder or arm, and they are innervated by the musculocutaneous nerve. And the anterior forearm and compartments of your forearm muscles will flex the wrist and the digits. So as you're kind of pushing your fingers like this, that's flexion. So that's your anterior arm muscles. And they are innervated by the median or ulnar nerve. So here we have a cross section. And if we kind of take a look, we kind of divide it here into a posterior and an anterior section. So this is the posterior section, the triceps. They will extend the forearm, and the anterior muscles in the anterior compartment, like your biceps and brachialis, will flex the arm. Here's another cross-section view, and it kind of separates out like this. The flexors, so these are on the anterior side of the arm, they will flex, so do this motion of your fingers. And the muscles in the posterior arm in the back of the forearm will extend, which is this muscle, kind of stretch your fingers back. Then the posterior compartment muscles of the thigh will extend the hip and flex the knee. So what that means, extending the hip means kind of straighten your leg back out if you would kind of kick your leg back. Flexing the knee means to kick your knee up to touch your butt. Innervation is mainly the tibial branch of the sciatic nerve. In the anterior compartment, you will flex the hip, which means you kind of like do a sit-up down, and extend the knee means you kind of kick your leg out like you're kicking a soccer ball. And the innervation on the anterior compartment of the thigh is the femoral nerve. Your medial compartment muscles on the inside of your leg will adduct the thigh, which means they bring your leg back to the midline. So if your leg is sticking out laterally, adduction means to bring it back down. The innervation is the obturator nerve. I don't think there's a lot of innervation questions. I think one innervation question might be the femoral nerve innervating the anterior compartment muscles of the thigh. The posterior compartment muscles of the lower leg contain digital and plantar flexors, which will help to plant your foot down. Innervation is the tibial nerve. Anterior compartment muscles of the leg contains extensors, which will kind of straighten out or extend your feet, and dorsiflexors, which brings your toes to your nose. And innervation is the deep fibular nerve. The lateral compartment muscles will plantar flex and evert the foot or move it out. And innervation is the superficial fibular nerve. So here's just a look at the hamstrings in the back part of the thigh. They will flex the leg and extend the thigh. So doing this action. Here's a look at all your quadriceps muscles on the anterior side of the thigh, and they will all extend the leg. That means to kick it out. Here's the medial compartment muscles, which will help to adduct the thigh or bring it back. Here's a look at the muscle compartments of the leg, the lower leg. In darker red, we have posterior compartment muscles, which will plantar flex the foot and flex the toes as if you're like taking a big step down. And then the anterior compartment dorsiflex the feet, so brings your toes to your nose. And you can see those actions there. The fibularis muscle is kind of on the lateral compartment, will help to evert the foot, so kind of take them off to the sides. Naming the skeletal muscle, they're named by their location. So like the brachialis muscle is in the arm. Their shape, the deltoid muscle is triangular, that's the shoulder muscle. and their relative size. So you can have a maximus, a minimus, or a longus to help indicate the size, like the gluteus maximus and the gluteus minimus muscle. The direction of the fascicles and muscle fibers, the name will tell us their direction in which the fibers run. So for example, the rectus abdominis is very straight. Rectus is straight. Transversus abdominis will be more transverse across. And the location of their attachments, the name reveals the point of the origin and insertion. So the brachioradialis goes from the brachial to the radius bone. The number of origins, so you can have 2, 3, or 4 origins to these muscles. The biceps, triceps, and quadriceps. The action part will sometimes be in the name, like a flexor, extensor, adductor, or abductor will give you the exact action of that muscle. So here is a look at some of the superficial muscles of the body. I really focus on muscles that are only in your lab muscle list for you guys to learn. And a posterior look. So muscles of facial expression will lie in the face and the scalp. They're very thin, variable in shape. They'll often insert themselves on the skin, so they won't insert themselves on the bones. And many are innervated by cranial nerve number 7, which is the facial nerve. So here are muscles of facial expression and what they do. Frontal belly of the epicranialis will raise your eyebrows and wrinkle your forehead, also known as the frontalis muscle. Some of these muscles I don't think we even cover. Orbicularis oris muscle, the circular muscle around your eyes will blink. Zygomaticus major, smile. Orbicularis oris, pucker, as if you're blowing a kiss. Mentalis is the muscle on your chin to help you pout. The platysma muscle helps you to tense your neck. So here are muscles of facial expression. Again, I'm going to cross over some of these rather quickly because you will be studying a lot of these in lab, but use this PowerPoint to help with that. And again, use those links in the lab module to practice naming these muscles as well. I use pictures on either models or look like this. I do not use cadaver pictures in your lab exam. 4 main pairs of muscles are involved in mastication or chewing, and they are innervated by the trigeminal nerve. So you have the masseter, temporalis, pterygoid muscles, buccinator muscles shown here. So here are your mastication muscles. Extrinsic muscles of the tongue help to move the tongue, and many are innervated by the hypoglossal nerve. So here are a lot of nerves that help move the tongue, and a lot of them name with glossus. So that glossus suffix has to do with tongue. Many muscles of the anterior neck and throat help to swallow. The neck is divided into an anterior and posterior triangle. We have ones that are either superior to the hyoid or inferior to the hyoid to help with swallowing. And then you have pharyngeal constrictors, which will squeeze the food into the esophagus. So here are muscles in the anterior neck and throat used in swallowing. Head movement, flexion by the sternocleidoid mastoid. So flexion is moving your head down, lateral flexion, moving it to the side, and then extension is straightening your neck back. So here are muscles of the neck helping to cause movements of the head. Trunk extension are deep muscles of the back to help maintain normal curvatures of the spine. They form a column from the sacrum to the skull. The erector spinae group is the largest of the deep back muscles. And in the erector spinae group, we have iliocostalis, longissimus, and spinalis. And these muscles run parallel with the spine to help keep your spine erect for posture. You have lots of muscles in between the vertebra, help to stabilize your spine. I don't ask you guys a lot of specifics about those, but you should know the erector spinae muscle group and what they're important for, helping keep your spine erect. Then we have deep muscles provide movements for breathing. External intercostal muscles lift the rib cage when you breathe in, and internal intercostal muscles aid in expiration or exhaling during heavy breathing. The diaphragm is the most important muscle for respiration, and it will flatten as it contracts to help increase the volume of the thoracic cavity. So here's a look at external and internal intercostal muscles because they're between the ribs and their striations go in opposite directions. And here's a look at the diaphragm from an inferior view. It has different holes in it for your inferior vena cava, the esophagus, which we'll talk about when we get to digestion and circulatory system, but this is where the diaphragm is located. You have lateral and anterior abdominal muscles. The lateral and anterior abdominal are formed from 3 flat muscle sheets. The external oblique is the most exterior, internal oblique is the next layer in, and the transversus abdominis is the 3rd layer of these lateral abdominal wall muscles. And then the 4th pair is the rectus abdominis, which is the straight. It inserts at the linea alba. So here we have the rectus abdominis going straight, and the linea alba is what it inserts itself on, a sheath of connective tissue which combines both sides of the rectus abdominis together. And then we have 3 layers of lateral abdominal muscles. The external oblique is the most external layer. We've cut a part of it out so you can see the internal oblique, and then the transversus abdominis is the innermost layer of the abdomen. So going from superficial to deeper, we have 1, 2, and 3. And this is a great way to see those layers, kind of 1, 2, and 3, and then how the rectus abdominis is in the center, connected by the linea alba. And then these are the 3 layers of the muscles of the abdominal wall. Movements of the scapula, we have the pec major, pec minor, serratus anterior, subclavius. I'm going to go over some of these rather quickly because a lot of this will just be used studying where these muscles are located. Movers of the scapula, these muscles help to move your shoulder blade. And as shown here, you can see the trapezius is this nice triangular shaped muscle. In all of these muscle models, you'll see the left side, which gives you a more superficial view, and then the right side of the model gives you a deeper view. So this picture, normally the trapezius covers, it looks like a diamond or a kite over the entire back. But on the right side, the trapezius has been removed to show some of the muscles that lie below the trapezius. We have the shoulder joint, flexible and unstable, and these are the large movers of the arm, deltoid, pec major, latissimus dorsi, shown here. And then from a posterior view, supraspinatus lies in the superior fossa of the scapula, infraspinatus lies below that. And then we have the teres major muscle, and the teres minor muscle is shown here, and the teres major muscle is below that. Posterior muscles will extend the forearm. This is the triceps brachii and the anconeus. Anterior muscles will flex the forearm, biceps brachialis and brachioradialis. Movements of the wrist, hand, and fingers will be tendons that are anchored by flexor and extensor retinaculae. Most forearm muscles will originate on the distal humerus, and movements at the wrist include flexion, extension, abduction, and adduction, and wrist and fingers are operated by muscles in the forearm. We have an anterior flexor compartment, which most of the digital and flexor carpal muscles are, and they are innervated by the median nerve and ulnar nerve, and they originate from a common tendon on the medial epicondyle of the humerus. And here are the superficial anterior muscles of the forearm, which are shown here. The retinaculum is kind of a piece that keeps all the tendons in place in the wrist, but one tendon goes on top of that, and that's the palmaris longus muscle tendon. So you can see how on the anterior forearm, these muscles will help flex the arm. Deep anterior muscles of the forearm also are flexor muscles, so the action tells you that they're flexing your fingers, and they'll be on the pollicis side, which is the big thumb side, digitorum going to the digits. So these are some more deeper muscles of the flexor forearm. Posterior extensor compartments, many are innervated by the radial nerve. They originate at a common tendon. And these are posterior muscles of the forearm. A lot of them will have the word extensor in their name because they will extend your hand, which straightens or pulls your fingers back. So here we have extensor forearm muscles. Deep posterior muscles of the forearm, again, many have the extensor name to them. They also might be a supinator muscle if they help to supinate the forearm, or abduct the pollicis, which means straighten out the pollicis muscle. So here we have more posterior compartment of the forearm muscles. Intrinsic muscles of the hand are fine movements of the fingers. They're all located in the palm. They include muscles of adduction, abduction, and opposition. I don't include a lot of questions on all the muscles in the palm of the hand. You can see here some of them will help with flex or extend, or abduct or adduct. And then opposition is moving your fingers with your thumb. So these are a lot of different teeny tiny muscles in the hand. I don't ask you guys a whole lot of details on these. Then we get down to the hip and the knee, the thigh and leg, the anterior and posterior muscles. Anterior will flex the thigh and extend the leg at the knee, which means kick the leg out like you're kicking a soccer ball. And flexing the thigh means kind to bring your thigh up to your belly button. And posterior muscles will extend the thigh or open the thigh up and flex the leg or kick your butt with your foot. Adductor muscles are in the medial aspect of the thigh, and they will adduct the thigh. The deep fascia of the thigh will surround and enclose all three groups. So here we have movements of the thigh, and it describes kind of all of those movements, then all the muscles and within each of the compartment that they're located. So here we have the quadriceps femoris, which is made of 4 muscles, the rectus femoris, vastus lateralis, and vastus medialis on either side. The vastus intermedius, the 4th quadricep muscle, is below that. And again, a lot of this you're going to have to just spend a little time studying the muscles on your own. The quadriceps femoris is the most powerful knee extensor. Here we have the adductor and medial muscles of the right thigh. Then we have posterior gluteal muscles, gluteus maximus, medius, and minimus, lateral rotators of the thigh. And you can see those shown here. So your gluteus medius, minimus, and maximus have been cut. The hamstring muscles, you have 3 hamstring muscles on the posterior compartment. These will all help to extend the thigh and flex the knee or kick your butt with your foot. And here's a look at the extensor posterior thigh muscles of the hamstrings. Muscles of the leg then, fascia lata of the leg surrounds these muscles to tightly bind them together. The tendons are held in place by different connective tissue, and muscle movements are at the ankle and intertarsal joints. We have a tibialis anterior, extensor, fibularis, and extensor hallucis longus. So these are all on the anterior compartment of the lower leg. And you can see these muscles here. The tibialis anterior goes along where your tibia will be. You'll have fibularis longus, fibularis tertius. All of the muscles on the anterior side will have tendons that go into the digits to help to dorsiflex your toes or pull them back or flex your foot. The muscles of the lateral compartment are fibularis longus and brevis. They're called fibularis because your fibula bone is on the lateral side of your lower leg. You can see those there. Superficial muscles on the posterior compartment, we have the gastrocnemius, soleus, and plantaris, and these will all help to plant your foot down, plant or flex your foot. So we have the gastrocnemius, the medial and lateral head. Deep to that is your soleus. The gastrocnemius attaches to the calcaneal tendon, which will attach to your heel bone, the calcaneus. Deeper muscles, you have a popliteus, flexor digitorum longus, flexor hallucis longus. The word hallux goes to your big toe, the tibialis posterior, and these are different intrinsic muscles of the foot, which will all have different movements of the foot. And I don't ask you too many details on the muscles of the foot because you have a lot of different muscles kind of laid out in a similar way as the hands. Then the next kind of ending part of this PowerPoint is on surface anatomy. And this is important to do palpation. So many doctors will palpate or feel internal structures through the skin. So you need to know from surface anatomy what structures are below the skin. Living anatomy provides really a lot of important information about palpation of arterial pulses, skeleton, muscles, and blood vessels, the sounds of the hearts and the lungs, and where to give injections. So the cranium are selected structures felt through the skin, looking at arches, the external occipital protuberance, mastoid process, temporal muscles, epicranius muscle. So these kind of take you through some surface anatomy of the head, the face, the neck, some skeletal landmarks. C7 is the spinous process that's very prominent. So you can look here and kind of review some of the surface anatomy, sternocleidomastoid, the trapezius, the posterior and anterior triangles of the neck, and some of the important structures within those triangles. I'm kind of going over some of this rather quickly. Jugular notches, sternum, mid-axillary line, mid-clavicular line, muscles of the thorax, the abdomen, umbilicus is the belly button, the linea alba will be the white line extending from the xiphoid process to the pubic symphysis, and the rectus abdominis. The posterior median furrow of the back, some crests. If you put your hands on your hips, what you're feeling right here is kind of the iliac crest of your hips. The trapezius, latissimus dorsi, axilla. So these are all things that you can feel through surface anatomy. And you can see here where you could feel the different muscles on the shoulders and the back. The shoulder itself, the acromion, is kind of what you feel at the tips of your shoulders. This is often where they might give you a shot or an injection if you got the COVID vaccine. The arm, then the humerus, biceps brachii. So different ways to see different surface anatomy. The ulnar, the cubital fossa is the antecubital fossa, which forms the anterior surface of the forearm. Then the bones, you can palpate your ulna and your radius. Flexor muscles, you can palpate some of the muscles and the tendons, and you can see those here. You can see the palmaris longus tendon really easily there. Anatomical snuff box is bordered by the extensor pollicis brevis, abductor pollicis longus, and the posterior extensor. So this is the anatomical snuff box that's bordered by some of those tendons in the thumb. The hand, you can see a network of tendons in your hand, the iliac crests, the cheeks of the buttocks. You can see more clefts and folds. Here's another part of an important place for an injection, sometimes for injection sites. Then the thigh, the patella, 3 groups of muscles in the thigh, another important part for an injection into those muscles. The femoral triangle is shown here, and you can see that it is described. The popliteal fossa, that's what I wanted to get to. This might be a test question. It's on the back side of the posterior knee. The leg and foot, you can palpate your patella to find your patellar ligament, structures of the proximal leg, the distal leg, as shown there. And then calf muscles. The foot tendons that can extend into the foot, and that gets us through this PowerPoint. I tried to point out important things you need to know, but a lot of it, again, is learning some of the muscles, but focus the studying of the muscles on the ones that are included in the lab list. Thanks for listening, guys. We just have one more chapter in this unit, chapter 12, and that will be an intro to the nervous system.